Have you ever wondered how our understanding of complex psychological experiences changes over time, sometimes even leading to a complete rephrasing of how we describe them? It is fascinating how science refines its language to better reflect new discoveries and insights. The term MPD, which stands for multiple personality disorder, is historically understood as the earlier name for what is now clinically recognized as dissociative identity disorder. This change in terminology reflects a significant evolution in scientific and medical understanding of the condition itself. This shift in naming is not just a semantic update. It is rooted in a much deeper comprehension of how trauma impacts the human mind. Originally, the focus was heavily on the observable multiple personalities. But over time, clinicians realized this was a fragmented sense of identity rather than distinct, separate people inhabiting one body. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, which is a key diagnostic tool, updated its criteria based on extensive research. It moved from focusing on a plurality of personalities to understanding dissociation as a core feature, a disruption of integrated consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. Understanding this historical context is crucial because it highlights how diagnostic frameworks evolve to become more accurate and less stigmatizing. It guides current approaches to diagnosis and treatment, emphasizing the underlying trauma and the integration of identity rather than simply managing separate alters. For anyone encountering information about this condition, knowing its history helps clarify why older references might use MPD while modern discussions focus on DID, ensuring clarity and an up-to-date perspective. An interesting nuance in this historical journey is the debate around the sociocognitive model versus the trauma model. While the trauma model, which links DID to severe childhood trauma, is the prevailing clinical view, the sociocognitive model proposed that some cases might be influenced by social and cultural factors or even therapist suggestions. However, overwhelming evidence supports the trauma model, illustrating the rigor involved in refining our scientific understanding of complex mental phenomena. This distinction underscores the importance of careful research in mental health. Ultimately, recognizing the historical progression from multiple personality disorder to dissociative identity disorder allows us to appreciate the advancements in neuroscience and psychology. This journey helps foster greater empathy and a more nuanced perspective, moving away from sensationalized portrayals and towards compassionate, evidence-based care, which benefits everyone seeking to understand the workings of the mind.